Okay, so this is going to be my last video of my mitral valve repair journey. Right now, as I currently sit here, I'm about 8 weeks post-op right now. But I'm gonna take it back to when I went home. So went home and stayed at my parents' for about a week. For the first few days, I stayed on my Oxy. I kept taking my Tylenol. Eliquis is a blood thinner that I had to take for 30 days, and then I am currently on aspirin for 6 months, one baby aspirin for 6 months with this, and then I was on a stool softener, okay? So eventually, a few days back, I finally got my first poop out, or I defecated finally. It was still a slow process. The biggest problem I had in recovery, once I was out of the hospital, so hospital was more pain management, okay? Once I was out of the hospital, the pain wasn't too bad. Yes, the cough, but overall, it wasn't too much of an issue. What I ended up struggling with was when I started reading or I was doing my computer work, I would start getting dizzy, kind of cloudy, or just in the peripherals of my eyes, it would just be fuzzy, hard to concentrate, and then it led to migraine. So though I think the Saturday night I had a bad migraine, really bad, wrote it out, and then the next night it got bad again, and I went in the bathroom, I laid in the dark, it just was horrible. The medication helped a little bit, but I was trying not to take the oxycodone, but I ended up doing it because I was trying to get off it. I ended up going to the ER because of the migraine. Never done it before. Well, long story short, went to the ER, and they made me wait in the lobby for an hour. So I'm sitting on a wheelchair underneath, covered, right? Don't want any light in my eye. And by the time they take me back, the migraine has passed. And then I go back there, and they have to run all these tests because I'm 4 days post-op or 5 days post-op, cardiac surgery. So they're all worried about stroke. So then I have to get another MRI, and I have to get another CT. And I'm like, and they never even gave me anything for the migraine because one, by the time I got back there, it was gone. So pretty much I went there to go get those extra tests, which weren't, I can't say they weren't needed. They have to cover their butts, but it was frustrating. I wanted something to relieve the migraine, never even got it. And I sat in the ER till about 4 a.m. By myself, it was about 6 hours that I sat there to get a bunch of tests to say, yeah, you don't have a stroke. Never really got any answers for the migraines. I don't know why I had that, why I was having the vision problems with it. So that next morning, I think it was like about a Monday morning, I went into my primary doctor and went to see them to get my stitches removed from my incision sites of the chest tubes. I guess I'll roll back. When they remove the chest tubes, it's not comfortable. It doesn't hurt, but it's not comfortable. One actually didn't hurt it at all, and the other one, I didn't like it. But it's quick. You'll be fine with that. But they have to sew it up still because there's going to be fluid in the cavity here that has to drain. So that's why you're hooked up to a chest tube throughout the process, even in not even the ICU, but in the floor. So you're on a walk, so you have to hook it to your walker and stuff like that if you need a walker. For that, so it was more than migraines. The biggest thing I had, don't know why I had it, really never got an answer as to it. I don't know if it was anesthesia, I don't know if it was the heart bypass, who knows. Since then, that's gone away. And it's been a pretty smooth process. The only things that I'm having right now is my heart rate sits in the 90s at rest. It used to be upper 50s, 60s. That's normal, they say. Sometimes people can go in AFib too, there's abnormal rhythm, so they have to go fix that on some. And I get a lot of orthostatic hypotension now through the process. So when if I get up quickly, I get dizzy, or if I reach down, come up, I get that a lot more than I ever did. I've been working out, just building up nice and slowly. Get really tired really quickly with out of breath. I get out of breath with strenuous stuff pretty quickly, so I'm just very deconditioned with that, and having a mask on because of COVID doesn't help the cause either. I did most of my recovery. I went down to Florida and just went by the beach and just went on daily walks there. I got out of Minnesota because otherwise I'd be cooped up in an apartment the whole time. So that made the process much nicer too, and much easier. There's no restrictions really on foods to eat. Once you get out of surgery, pretty quickly they get you going to your normal diet with that. So the recovery's been good. It's slow. You have to be patient. It's your heart. It takes time. It's like a muscle. You just have to build it up. But overall, It was a smooth process. I highly recommend the Mayo. I highly recommend, if you can get it, the minimally invasive robotic surgery. That made the process easier. I got back to work. I did a part-time week the first week to build up my stamina, get my brain thinking a little bit before I went back to full-time. And it's been good since. So overall, I had a great experience with it. Obviously kind of weird at 29 to have this happened, but it was great that we caught it. That's why prevention is so important. That's why you should get your physicals, because you just never know. Even though you look healthy on the outside, you never know what's going on the inside. And stay on top of your health and be proactive. And then the stronger you are and the more in shape you are, anytime you go into surgery, odds of your outcomes coming out are going to be much greater versus someone who's out of shape or obese or has a lot of comorbidities. Okay, that's why it's so important to stay on top of things. One, odds of something happening are less likely, but if they do happen to you, it's probably going to have a better chance for recovery or having a better outcome. I hope this video series helps some of you out there who may be going through the same thing or just been diagnosed with, a mitral valve prolapse or something along those lines, or even some different kind of heart problems. That there's different options out there. You just have to consult with your cardiologist and your cardiothoracic surgeon and really do your homework and figure out what's best for you to get you back. But this was my journey. It worked out well. We're still on the mend, 8 weeks out. It's going to be a while, I know, still, but it's taken care of. My heart, when they looked at it after, the valve was working. And so I'll probably have to get an echocardiogram once a year just to make sure it's still doing its job as I progress through life. And if you have any questions, again, feel free to reach out to me. I'd be glad to help anyone who may be going through this and is concerned, anxiety is high, just to have some, I can answer questions from what I went through, okay? But again, a lot of the medical decisions you need to have with your provider. Take care. Thank you for watching this video. If you found this information useful or helpful, please subscribe to this channel. Just drag that mouse right over to the red box, click it so that you're notified the next time that I post a video. Again, thank you so much.